Jennifer. Hi, Tina. Hello, the rest of the crew. And so the plan today is to look entirely forward at policy. And I believe we've come to a conclusion that today is policy day and tomorrow is not. And so the intention I will be carrying out here is to adopt as much policy as we have in front of us that we can get through in the first segment here. And we'll then take a recess for a period of time that the other two chairs and we can think makes sense, just to finish up any stray amendments or last minute discussions you want to have. I know there's a couple for sure that we should have. And then the point is at the conclusion of today's work, when we drop the gavel to say goodbye, that will be the end of the policy discussion in this conference time. Representative Liebling, does that sound good to you?
Yeah, well, first of all, good afternoon, everyone. And yeah, I think our hope is to wrap up the policy provisions today. And I think we're close. We've got some we're going to be able to do this morning or this afternoon. And hopefully we can go through those pretty smoothly. We've got agreements on a lot of things, and then we're going to need a bit of time to have some discussions offline. And then hopefully, I think, as you said, Senator will come back and finish up.
Yeah, and in my head, I was thinking 7, but I don't know. We'll see how long it takes here. And then between you and Jen and us, we can think of what time makes sense. So there's no need to drag it out, but we want to allow enough time. And then to the future of this bill, I believe this bill has a bright future. I also believe in America and apple pie, and I love my mom. So just so you know the context that's all in, but we are doing all we can do to get the policy out of the way. So then by what I would like at the point of the, maybe I'll even make a motion that will move that these articles are closed and cannot be opened. But that doesn't mean that if we can get some agreement on finances, that some stray policy thing couldn't find its way into there. But in terms of these articles and the work they're going to be getting done, that'll be the end of every article that we're going to wrap up. So
Mr.
does
Chair,
that sound good? Senator Benson.
Mr. Chair, do you intend to close articles today?
Well, we're going to yeah.
Because if we close articles that have money in them, are we not?
Oh, well, whatever
Okay.
I don't know. We're going to get down to all the policy today. So
Okay.
I don't care if we close an article or vote to close it. We're just going to be pretty done talking about policy. So that's the point we have to, that's all. So maybe we'll take advice from the reviser and staff, and maybe I'm always out over my skis on this, but maybe it makes sense that if there's some fragment that goes, we have that in a fiscal article later or something. But the reviser and the staff will kind of offer us good advice, and when I'm smart, I listen to them. So, right, Ms. Kavanaugh? Okay,
yeah,
anyways.
Senator, I would just suggest that, we're not going to do everything right now. We're going to do what we've got agreed on, which actually is quite a bit.
Yeah.
And then we're going to break. And during that break, I think it would be very good, as always, to take advice from our nonpartisan staff about the best way to proceed, because the last thing we want to do is make their very difficult job even harder by confusing them or asking them to do things in a way that isn't smooth and easiest for them. So I know.
Thanks, Representative. I can't imagine that our staff would ever be confused by me. I just don't know
sure
how
not,
that ever could have been. Maybe that's possible. Anyway, so moving along, there's at least one sheet here, and I have no idea what all there is that we're going to get through, but everything we can, I would like to get through. And so where there's a script here in front of us of 3 pages, I believe it's posted, so people can see how their item did. And so if we can go through that first with the staff outlining it, and then without any being called on, if some Liebling would just move it, and without being asked that people understand the motion, we'll just vote on it. All right. If somebody thinks we're going too fast, let me know, but I think we just want to kind of fly through this.
Senator?
So, does that sound good?
Oh, Senator, if I could, I think our understanding and probably the way we think this might go the smoothest, and the suggestion came from the Senate staff as well, as we have the list in front of us. And I think we can move through this quickly and also give the public a little more opportunity to know what's being voted on and so on. If
Oh,
we,
I meant that. So
no,
again, me
no,
being
sure.
clear.
I just want to
So-
clarify what we're going to do.
Yeah.
And maybe this was your intention, but
Yeah,
each item, nonpartisan staff can just mention and tell us just very briefly, and we've got some descriptions here, what it is. And then I will move to adopt it into the conference report. We'll have a vote
and then
and we'll
move
move
on.
on to
Yeah.
the next one.
So they're all cleverly numbered with a dot, so that'll keep it really easy to follow.
Right, but
So,
we'll vote
Mr.
on
Chair-
each one,
Mr.
right?
Chair? Do we have
Representative
copies of the hard copies of the list? I don't know that I have that, yeah.
You don't get one.
Oh, here we come. You're gonna get me one. Thank you,
Okay,
sir. Thank you, sir.
fine. Okay, so I think without further ado, I have a feeling the staff knows who's going to do what, so I'll just let them go between themselves. And so we're starting out with House Article 2, Senate Article 13. I think I'll just list the main header and then let the Department of Health policy people do what they do.
Mr. Chair and members, Elizabeth Clark-Fisk from House Research, and I'll be going through Article 2. So the first section to consider is House Article 2, Section 1. This is a House-only section. It modifies the nursing home resident assessment schedule.
All right, so Mr. Chair, I would move adoption. And this is all adoption into the conference report on Senate File 4410. I would move adoption of House Article 2, Section 1.
All right, and just by the way, if any members have any questions, just sing out. So all in favor, say aye.
Aye.
Opposed? It's adopted.
The next section is House Article 2, Sections 2 and 3. These are changes to the definition of byproduct material for sections governing radioactive materials and radiation of producing equipment.
Mr. Chair, I move adoption of House Article 2, Sections 2 and 3.
All in favor, say aye.
Aye.
Opposed? Adopted.
The next section is House Article 2, Section 5, as amended by the S4410A77-1 amendment. And this expands the existing home and community-based services employee scholarship program to also allow these funds to be used for loan forgiveness.
So do we have that amendment then? We don't have that amendment.
Mr. Chair, I'm sorry, it was updated yesterday,
Okay,
and it looks like there was some miscommunication between nonpartisan staff and partisan staff about which version was to be available to the committee today. So I don't know if you want to
Well,
skip this one and come back while we try to get it printed.
well, yeah, so let me just explain. So that is no, we're gonna get this done right. We're not gonna have a 99-page fix-it bill like we did a few years ago. And so if there's something that needs to be worked on or just gotten the right one, it's no big deal to say there's an amendment to come, and we'll just leave that open. And then in the break, you can get that all squared away. So don't really rush around unless you want to get something squared away now. So we'll take one pass through this list, take whatever else we're gonna do. And then if there's something ready by the time we get through the one pass, we'll come back to it. The next item, please.
Mr. Chair and members, the next section is House Article 2, Section 6. This is a change to the Immigrant International Medical Graduates Assistance Program, and it allows the commissioner to award grants to a higher education institution to provide graduates with career guidance and support services.
All right, Mr. Chair, I move adoption of House Article 2, Section 6.
All in favor, say aye.
Aye.
Opposed? Thank you. Next.
And Mr. Chair, I'm sorry, I'm getting a message that another member doesn't have a copy of the document. And
It's posted, it's on the Senate or whatever page this is listed on, I think.
And-
So otherwise, if you want to just text JP and he can get it. That
Or,
person can text JP.
oh,
We'll send him one.
okay, Mr. McQuillan
Oh,
just
she-
emailed it, so I think we'll be
Okay,
good.
perfect.
So,
Yeah, we want people
okay.
to have stuff. This is just that good reading. I mean, this is kind of like a bestseller, I think, you know.
yes, indeed. Okay, so we just, so if I'm still in the right place, Mr. Chair, I move adoption of House Article 2, Section 6.
Can we do that? Oh, yeah. All right, all in favor, say aye.
Aye.
Opposed? Done. Thank you.
The next section is Senate Article 16, Section 5, as amended by the S4410A68 amendment. This modifies posting and reporting of data on STEMI response and treatment, and the amendment makes the posting requirement annual instead of quarterly.
Senator Representative Liebling moves to A68. Would you please describe it? Ms. Clarquist?
I think she
The
just did.
amendment, sorry.
No,
just-
go ahead, Ms. Clarkist.
The amendment just makes the requirement, the health department posting requirement that that the data is posted annually instead of quarterly.
All in favor of the amendment, say aye.
Aye.
Opposed? Senate Representative Liebling.
All right, thank you, Mr. Chair. So I move adoption of Senate Article 16, Section 5 as amended. And Ms. Clarkist, is that a sufficient, or do I need to restate the amendment? No, right?
I think that's sufficient.
Okay.
All in favor, say aye.
Aye.
Opposed? Passed. Thank you. Approved.
The next section is House Article 2, Section 9, Clause 32. This is the hospital construction moratorium exception for Children's Hospital.
All right.
I have a
Mr.
question
Chair.
about that. Is that just the clean one place version that they get the exception? Is that what we settled on?
These
Okay.
these exceptions were identical in both bodies.
Oh, okay, there was, okay.
There
Thank
was
you.
a separate exception that I think is still being worked on.
Thank you very much. All right. All in favor, say aye. Aye. Opposed? They get the moratorium. All right. Next.
The next section is House Article 2, Section 10. This excludes dental clinics that use dental cone beam computerized tomography from the definition of diagnostic imaging facility.
Mr. Chair, I move adoption of House Article 2, Section 10.
All in favor, say aye.
Aye.
Opposed? Adopted.
The next set of sections are House Article 2, Sections 20 through 25 and 80.
61.
These amend the nursing home licensure statutes and make changes related to changes of ownership. And it includes requiring additional information to be included on licensure applications, allowing the commissioner to bar controlling persons in certain circumstances, prohibiting transfers of licenses, and requiring the commissioner to consider additional information. And these sections are amended by the S4410A61-1 amendment, which is a technical amendment.
And is that available? Is that one of the ones that's not available? Okay, let's agree at the 61 and just so people watch, if you're, one of our, like Senator Hoffman, one of our massive audience, sometimes an agreement works out in the last few minutes. So here's Amendment 61, but we have an improved version. So we want to improve it. Moving on.
The next section is House Article 2, Sections 26 and 27. These make changes to the membership and duties of the Home Care and Assisted Living Program Advisory Council.
Mr. Chair, did we move the A61?
Senator Benson, the A61-1 is not available. We have the 61, so it's being
Okay,
replaced.
but Mr. Chair, did we move the article?
No, we're just moving on.
Okay.
So we're on the Home Care Advisory Council now.
All right. So
Representative Liebling.
thank you. So I move adoption of House Article 2, Sections 26 and 27.
All in favor, say aye. Aye.
Aye.
Opposed? Thank you very much. Adopted.
Mr. Chair, the last section in this article is Senate Article 13, Section 8. It modifies the definition of palliative care in the hospice care statutes.
Mr. Chair, I move adoption of Article 13, Section 8.
All in favor, say aye. Aye.
Aye.
Opposed? Adopted. House Article 3, Senate Article 3, Healthcare Finance.
Mr. Chair, Randy Chen with House Research.
Randy.
I'll be going through Article 3 and Article 4. So the first section in Article 3 is House Section 12. This requires DHS to report annually on provider dental enrollment.
All right, Mr.
Sounds
Chair,
good.
I would move adoption of House in Article 3 now, House Article 3, Section 12.
All in favor, say aye.
Aye.
Opposed, adopted.
The next section is Senate Section 9. This prohibits the Commissioner of Human Services from adjusting rates for enteral nutrition and supplies.
So, Mr. Chair, I move adoption of Senate Article 3, Section 9.
That's a great section. So all in favor of that amazing section, say aye.
Aye.
Opposed. My favorite one so far. Next one, please.
Next section is Senate Section 10. This provides that telephone visits satisfy the face-to-face requirement for FQHCs and other clinics.
Mr. Chair, I move adoption of Senate Article 3, Section 10.
All in favor, say aye.
Aye.
Opposed, adopted. House Article 4, Senate Article 3, Healthcare Policy.
So,
Massive
Mr.
section,
Chair,
Chung.
Mr. Chair, there's one section in that article, Senate Section 8. This deals with reporting provider reimbursement rates for substance use disorder services.
Mr.
And-
Chair, I move, oh, I'm sorry.
Oh, and people say we couldn't find agreement on healthcare policy. Like, anyway, there you go. Representative Liebling.
Yeah, so I'm delighted because I got the section into law last year on the reporting, and now everybody wants to report more, and so I'm really
Oh,
happy to have it in
very
there.
nice.
So I happily move adoption of Senate Article 3, Section 8.
All in favor, say aye.
I should just say
Opposed.
that it's Article 4.
Oh, I'm sorry. I'm sorry. Yeah, it's not here on the sheet. Article 4, Senate Article 4. Okay.
Senate Article 3.
Oh, no, wait. It's
It'd be
House
the
Article 4, Senate.
House
3.
Article 4
It's-
and Senate Article 3. It's in
So
that
I was
comparison
right the
article.
first time.
I think they won't.
Sorry.
Anybody know what
Sorry
we're
about
doing here?
that. Yeah.
All in, so the motion is made. All in favor, say aye.
Aye.
Opposed. And actually, both the Representative Liebling and I made little happy dances on certain things. But so if a member wants to mention something about a section, feel free. This is actually still a meeting of all of you. So anyway, House Article 5, Senate Article 14, Health-Related Licensing Boards.
Mr. Chair and members, the next article is Article 5, the health-related licensing boards. And the first sections to be adopted are House Sections 7 through 17 and 21. And these deal with the changes in the Board of Dentistry statute that modifies specialty and guest dentist licensure requirements and dental therapy licensure by credentials and various other clarifying changes.
So, Mr.
Representative
Chair, I move adoption of House Article 5, Sections 7 to 17 and 21.
All in favor, say aye.
Aye.
Opposed. It's approved, whatever.
The next section is House Section 18. And this section modifies the scope of practice for pharmacists that allows pharmacists to do the intramuscular and subcutaneous drug administration and the placement of drug monitoring devices.
So, Mr. Chair, I move adoption of House Article 5, Section 18.
All in favor, say aye.
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 Opposed. It's adopted. Couldn't think of that word.
And the last section in Article 5 is House Section 20. And this is temporary requirements governing ambulance service operations and emergency medical services.
And Mr. Chair, could I just ask a quick question of Ms. Kavanaugh on this
Ms.
one? Ms. Kavanaugh, does this include the, I assume this includes the driving piece, but also the medications piece?
Ms. Kavanaugh.
Mr. Chair, I'm not sure what you mean by the medications. The difference in this, it's in both the House and the Senate, and the only difference was that the House included the facility
Oh,
transfers in this.
Okay.
That's all.
all right. Thank you, Mr. Chair. I move adoption of House Article 5, Section 20.
All in favor, say aye.
Aye.
Opposed, it's adopted. House Article 8, Section Article 8, Community Supports and Behavioral Health Policy.
Mr. Chair, this is another case of an updated amendment that we don't have.
Okay, let's just
yet,
pass.
So we'll
Move on.
have to come back to that later. The next section is Senate Section Article 8, Section 47. This is actually part of the proposal for the item above it. It's just the Senate, in this case, the Senate language was preferred.
Skip that one. We're doing it.
So, Mr. Chair, did you maybe prefer to skip
Yeah.
this one and do it with when we come back?
No, you can move it.
Do
It's
it?
a section.
Okay,
Do chapter
all right. I'm gonna move adoption of Senate Article 8, Section 47.
nine.
All in favor, say aye. Aye. Opposed, adopted.
Mr. Chair, the next section is House Article 8, Section 3. This contains clarifying changes regarding case manager qualifications for the purposes of adult mental health services.
Mr. Chair, I move adoption of House Article 8, Section 13.
All in favor, say
No.
aye. Aye.
Aye.
Opposed, adopted.
Mr. Chair, that she misstated the motion.
I'm sorry, was it 3? Did I say 13?
You did.
I
You wanna-
apologize.
Why don't
House-
you just re-say it and we'll have
Okay.
a bonus
All right.
motion that
I'm
goes
gonna-
with this.
All right, I'm gonna move adoption of House Article 8, Section 3.
So actually, is there a section 13 that we just adopted that we didn't even know? Well, let's take that motion up and pass that. And I think we'll reconsider and withdraw that other motion, just so we don't adopt
Okay.
something weird. All in favor of the motion to adopt section 3, say aye. Aye.
Aye. All right,
Opposed,
and Mr. Chair, I would move to reconsider my previous motion adopting Section 13.
did you vote on the prevailing side? All in
I think
favor of
so.
that, say aye. Aye.
Aye.
Opposed. All right.
All right, now we'll
Moving on.
withdraw that one.
Yeah, that's, very good. Next one, Senate.
Mr.
848.
Chair, the next provision is Senate Article 8, Section 48. This contains some language requiring the commissioner to continue stakeholder engagement with respect to the EIDBI benefit and future modifications to that benefit.
And that's really a thoughtful thing, and maybe it doesn't matter, but it means a lot to the providers who are working so hard. So Representative
All
Liebling.
right, well, thank you, Mr. Chair. I'm delighted to move it then. Senate Article 8, Section 48.
All in favor, say aye.
Aye.
Opposed. Another happy dance one. Okay,
Mr. Chair, members, the next section is Senate Article 8, Section 52. This section contains a clarifying language regarding the definition of excluded time for the purposes of determining the county of financial responsibility for the provision of community integrated supports and day support services.
thank you, Mr. Monahan. If a candidate would read that, they would never want to be on our committee. So anyway, let's keep that away from
All
people.
right,
Representative Liebling.
All right, Mr. Chair, I move adoption of Senate Article 8, Section 52.
All in favor of this arcane article, please say aye.
Aye.
Opposed? Thank you. It's just really complicated. House Article 11, Senate Article 9, Continuing Care for Older Adults Policy.
Mr. Chair, members, these sections from House Article 11 are the DHS Continuing Care Policy Bill. And one section from House File 3242. And there's an amendment, the SCS 4410A80. This is new language permitting the inclusion of the costs related to, what are they called again? Individual coverage, expense, reimbursement arrangements, which is a healthcare product that employers can provide to their employees. Nursing facilities would be allowed to include the costs of these products in their cost reports. And then there's also a modification to the treatment of costs that are incurred but not paid, requiring that they be paid within 140 days of the end of a payment period unless the delay is waived by the commissioner for certain contractual obligations.
Any questions about that one? That one actually could bear some questions. So Representative Leland, do you want to move the A80 amendment?
Mr.
Yes, Mr. Chair, I'd first move the SCS 4410A80 amendment.
Okay. Senator Benson.
Mr. Chair, I just wanted to clarify because it looks like we're adding things that would be allowable costs. Can Mr. Monahan just assure us that this has no fiscal impact?
Mr. Monahan.
Madam Chair, Mr. Chair, Senator Benson, it's my understanding that it doesn't have a fiscal impact. It's simply allowing the providers to use a different or an additional vehicle to cover their employees that currently isn't available to them.
Senator Benson.
Thank you for the clarification, Mr. Chair, Mr. Monahan.
Okay, all in favor of the A80, say aye.
Aye.
Opposed. Adopted.
All right,
Representative
with
Liebling.
that, Mr. Chair, I would move for adoption of House Article 11, Sections 1 to 31. And let's see. Okay, I think that's, can staff please tell me, is that the correct motion?
Monahan.
Article 1, Sections 1 to 31.
With
That all
the
we need?
addition
As
of
amended, as amended.
We're good. Oh, that's the ICHRA. I knew there was an acronym for that. All in favor of that with the acronym, say aye.
Aye.
Opposed, adopted. House Article 13, Senate Article 10, Child and Vulnerable Adult Protection Policy.
Mr. Chair and members, Sarah Sunderman from House Research. The first item in this article is House Article 13. This is several sections. It's sections 1, 3, 4, 7 to 18, 20 to 22, 24, and 25. These are all sections that were part of the DHS Child Welfare Policy Bill.
Representative Liebling.
Thank you, Mr. Chair. So I move adoption of House Article 13, Sections 1, 3, 4, 7 to 18, 20 to 22, and 24 to 25.
All in favor, say aye.
Aye.
Opposed, they're all adopted.
The next item is Senate Article 10, Sections 23 and 24. These are also sections from the DHS Child Welfare Policy Bill. They were just technical differences between the two, and staff suggests the Senate language on these.
Mr. Chair, I move adoption of Senate Article 10, Sections 23 and 24.
All in favor, say aye.
Aye.
Opposed, it's adopted.
Next item is Senate Article 10, Section 43. It's the same thing. It's part of the DHS Child Welfare Policy Bill, technical differences where staff suggests Senate.
Mr. Chair, I move adoption of Senate Article 10, Section 43.
All in favor, say aye.
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 Opposed, it's adopted.
The next item is Senate Article 10, Section 36. This relates to caseworker visits being conducted when possible outside of the presence of a parent or foster parent.
Mr. Chair, I move adoption of Senate Article 10, Section 36.
All in favor, say aye.
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 Opposed, it's adopted.
Next item is House Article 13, Sections 2 and 19. These relate to changing the preference to placement with a relative for a child who cannot return home.
Mr. Chair, I move adoption of House Article 13, Sections 2 and 19.
All in favor, say aye.
Aye.
Opposed? It's adopted.
The next item is Senate Article 10, Sections 46 to 48. These relate to the Maya's Law proposal, modifying procedures for child maltreatment, face-to-face contact requirements and interview requirements, and requiring documentation of family assessment outcomes. There is an amendment, a technical amendment for these. I don't know.
We have it. Representative Liebling can move to A71.
All right. Mr. Chair, I move adoption of the S4410A71 amendment.
Any more description of that needed? No. Okay, all in favor of that, say aye. Aye.
Aye.
Opposed? It's adopted.
And then, Mr. Chair, I would move adoption of Senate Article 10, Sections 46 to 48 as amended.
And just a comment on this. I mean, we're spending like a minute and a half on this thing. This is a really important matter about children and maltreatment, and it was very complex. And the topic is fraught with peril, or not fraught with peril, but it's just so hard to do. So I'm happy we can get to this agreement. So I'm going to vote for this. So all in favor of that, say aye.
Aye.
Opposed? All right, that's adopted happily. Okay, next.
The last item in this article is Senate Article 10, Sections 50 and 51. This requires the transfer of the total amount of aid reductions for the tribal and training certification partnership, and also makes a conforming change.
Mr. Chair, I move adoption of Senate Article 10, Sections 50 and 51.
Thank you. And that's a Senator Kunish provision. It's a really good idea. All in favor, say aye.
Aye.
Opposed? I think my lobbying must have helped. House Article 15, Senate Article 10, Economic Assistance Policy.
Mr. Chair, Danielle Pinelli from House Research. House Article 15, Senate Article 10, the Economic Assistance Policy Article. The sections for consideration are House Sections 1 to 5. Sections 1 to 3 are from two different DHS economic assistance policy bills. And sections 4 and 5 are from House File 4527, which instructs the revisor to renumber some statutory sections related to food support and also repeals some obsolete language. And there is an amendment, the S4410A48 amendment, which just
Senator
adds.
Liebling, if you want to move the A48, please, with the effective
Yeah.
date.
Okay, is that Ms. Punelli? That's what the amendment does? Is
Ms.
just
Punelli,
changes-
I didn't mean to, I thought you were done. I'm sorry. Go ahead, finish up, please.
The A48 amendment just adds a special effective date.
Okay, thank you. Yeah, Mr. Chair, I move the S4410A48 amendment.
All in favor, say aye.
Aye.
Opposed? It's adopted.
And then, Mr. Chair, I would move adoption of House Article 15, Sections 1 to 5 as amended.
All in favor, say aye.
Aye.
Opposed? That's adopted. Oh, House Article 16, Senate Article 10, Economic Assistance.
Mr. Chair, the section for consideration in this article is House Article 16, Section 9, which clarifies that tribal nations are eligible for emergency assistance grants.
All right, Mr. Chair, I would move adoption of House Article 16, Section 9.
All in favor, say aye.
Aye.
Opposed? That's adopted. Article 17, Senate Article 12, Direct Care and Treatment Policy.
Mr. Chair and members, the first item is Senate Article 12, Section 1. This relates to the voluntary transfer of committed individuals back to a secure treatment facility.
Mr. Chair, I move adoption of Senate Article 12, Section 1.
Oh, it's nice we're getting that done. All in favor, say aye.
Aye.
Opposed? It's adopted.
Next item is House Article 17, Section 2. This modifies mandated report expirations.
Mr. Chair, I move adoption of House Article 17, Section 2.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
Next item is Senate Article 16, Section 15. This is the Minnesota Sex Offender Program reporting repeal that both bills had, but in different ways.
Mr. Chair, I move adoption of Senate Article 16, Section 15.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
And House Article 17, Section 4 is a repealing obsolete sections.
Mr. Chair, I move adoption of House Articles. Let's see. House
Um,
Article 17, Section 4.
All in favor of getting rid of cluttering sections, say aye. Aye.
Aye.
Opposed? Adopted. House Article 18, Senate Article 10, preventing homelessness.
Mr. Chair, the first sections for consideration are House Article 18, Sections 2 and 3, which allow people to reside in transitional housing for up to 36 months.
Mr. Chair, I move adoption of House Article 18, Sections 2 and 3.
All in favor, say aye.
Aye.
Opposed? That's adopted.
Mr. Chair, the next section is from Senate Article 10, Section 55. It extends the reporting deadline for the Task Force on Shelter.
Mr. Chair, I move adoption of Senate Article 10, Section 55.
I think that's why a lot of the people are in the audience hoping this thing passes. All in favor of that, say aye. Aye. Opposed? That's adopted.
Mr. Chair,
Oh, I forgot to say a thing, so I'm screwing up on my script here. House Article 22, like, they don't just, anyway, not going to be on TV very long. House Article 22, Senate Article 3, House Miscellaneous, Senate Healthcare.
so the first sections are, let's see, Senate Article 3, Sections 1, 13, and 15. And the sections that move the Rare Disease Advisory Council.
Mr. Chair, I move adoption of Senate Article 3, Sections 1, 13, and 15.
All in favor, say aye.
Aye.
Opposed? That's adopted.
And then House Article 22, Section 18. And this prohibits providers and organ procurement organizations from making decisions about access to anatomical gifts that based on race or ethnicity.
Mr. Chair, I'm very pleased to move House Article 22, Section 18.
Thanks, and Rips and Liebling, I don't even know why. It's just sad we need to pass a law like this, but
Yes,
good
it
for
is,
us.
Mr. Chair, but if.
Anyway,
it
here we
is
go.
Necessary, unfortunately.
Here we're about to vote on a really cool thing. So all in favor, say aye.
Aye.
Opposed? Very nicely done. Thank you. House Article 23, Senate Article 17, forecast adjustment and carry forward authority.
Mr. Chair, we can move the entire article and get this one cleared out. There were technical differences between the House and Senate in these two articles. So it's the staff recommendation that you consider Senate Article 17, Sections 1 to 11, and House Article 23, Section 12.
All right, Mr. Chair, I move adoption of Senate Article 17, Sections 1 to 3, and House Article 23, Section 12.
You might want to say 1 to 11. That's not labeling. You said 1 to 3, so.
Oh. Okay, I'm sorry. All right,
That's
let's
okay.
start over. And you know what? Let's do
Kind
it
of
one
1,
line
2,
at-
3 kind of flows, but.
Let's do
yeah.
it one line at a time as well.
Sure, we can do
All
that.
right, that just make it easier. So I move adoption of Senate Article 17, Sections 1 to 11.
All in favor, say aye.
Aye.
Opposed? That's adopted.
And then I would move House Article 23, Section 12.
All in favor, say aye.
Aye.
Opposed? Last on this list, but certainly not least, Senate Article 16, mandated reports. We did a lot of work on
And
this one.
Mr. Chair, for this article, can adopt Senate sections 1 through 4, 6 through 14, 16 through 34, and 36. And these just do changes to required annual reports based on that mandated report that we had from last year.
Very nice.
All right, Mr. Chair, then I would move adoption of Senate Article 16, Sections 1 to 4, 6 to 14, 16 to 34, and 36.
All in favor, say aye. Aye.
Aye.
Opposed? That's adopted, and good job, Senator Benson. Okay, so that's those.
Can we go back? Yeah.
Oh, yeah, you have the amendment? Who wants to go first? Mr. Monahan?
Mr. Chair, members, we could return to House Article 8, Senate Article 8.
Yeah.
And we could, that first bullet point there, House Article 8, Sections 1 to 4 to 24, 26 to 31, and 33 to 41 are all the DHS Community Supports and Behavioral Health Policy Bill with the S4410A83 amendment, which is technical assistance from DHS, mostly correcting cross-references and adding effective dates. I will note, just, we need to come back to House Section 25, having to do with telehealth. It's amended in 2 places in the bill, and we need to reconcile them. We have the amendment to do that, but that we need
Some more time?
No.
we need input from members before we can do that. So this evening, maybe we can come back to that.
Sure, after the break. So Senator Liebling moves the A83 amendment.
So, Mr. Chair, does it make sense then or staff, does it make sense to do the amendment now and then come back and revisit this other piece that?
Representative Liebling, we're
talking about?
skipping section 25 for later work. So that's excluded from the motion.
Okay, all right. So, Mr. Chair, that being the case, I move adoption of the amendment, the S4410A83 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
And then, Mr. Chair, I would move the House Article 8, Sections 1, 2, 4 through 24, 26 through 31, and 33 through 41 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? What now, Ms. Kavanagh?
Mr. Chair, I think we can go back to House Article 2. And we now have, so House Article 2, Section 5, we have that amendment now, the S4410A77-1.
All right. So, Mr. Chair, I would move adoption of the S4410A77-1 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? That's adopted.
All right. And then, Mr. Chair, I would move House Article 2, Section 5 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? Ms.
Then-
Monahan or
And then,
Mr.
Mr.
Monahan
Chair,
or
we
Ms.
have
Kavanagh?
the down in Article
dash
2, Sections 20 through 25 and 80, we now have the
Okay.
S4410A61-1 amendment.
Representative Liebling.
All right, Mr. Chair, I will move the S4410A61-1 amendment.
All in favor, say aye.
Aye.
Opposed? It's adopted.
All right, and then I will move the A2, sorry. All right, this is this House Article 2? That's what it is, right? House Article 2, sections 20 to 25 and 80 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? There you go. Mr. Monahan or Ms. Kavanagh? Okay, good. So that's that. Mr. Yates or whoever knows, what else are we gonna do? Is there more work available for us? Mr. Monahan, Ms. Kavanagh, Ms. Liebling.
So, Mr. Chair, my understanding is this is the point at which we probably would pause
Sure.
and see if there's more that we can work out. I think this kind of completes that first batch of things that have been worked out, but they're more in process. This is you know,
Right,
there's some that just didn't make this first cut, but there's more, and there
Right,
will be
yeah, I know.
more in a little while. So,
perfect. So, to my other chairs, how long do you want? Like 3 hours? You come back at 5?
just to let you know, I think we have floor session this evening, just not that, you know, we can still work around that, but I believe we have floor session scheduled at 4 o'clock, although that, of course, may change.
So, Reps Liebling, when do you think you want to come back? I mean, do you want to say 5 or do you want to, I don't do a call, I don't want to say 5 and then it's like 7 for people, but
No,
do
sure.
you want to do it late? Do you have a lot on the floor today?
I
2
don't-
bills and a concurrence.
Yeah, I don't think there's a lot.
You want to shoot for, or take a vote or whatever, tonight's the night for that. So this is like your window of opportunity, because then there's no more policy vehicle, or at least those sections will be not available to be worked on. So that's all I'm saying.
But thanks for
And I don't-
clarifying, because they
I don't
can't be
want
a
full- I don't-
free-for-all. We can't, I
Yeah.
can't work on policy that's not been through committee or, you know, that I've never seen. And our staff, I think, would appreciate if we really narrowed it to what's in our, one of our
But just, you know,
bills.
Representative Schultz, a person has a right to bring anything they want any old time, which Representative Berglund certainly proved, which we don't want to emulate. Sorry for the heart attack, people, but it makes good TV sometimes. Anything else, Senator Aki or anybody else? Okay,
Mr.
well, with
Chair?
that, yeah,
I apologize. Would it be possible to go back to one of the motions to make it a little more precise?
absolutely. This is, please. Ms. Clarquist.
So it was the motion for in Article 2, House Article 2, sections 20 through 25 and 80. It should have only been section 80, paragraph B. And I neglected to include paragraph B on the list, and I apologize for that.
Oh, so it's just 80B. Okay,
80
Representative
paragraph B.
Liebling will move to
Yeah.
reconsider her
Yes.
motion by which we adopted what you just said. Article 2, sections 20 to 25 and 80. So all in favor of, is that okay? All in favor of reconsideration, say aye.
Aye.
Opposed, that's reconsidered. I believe then you can withdraw
All
that
right.
motion
Mr.
and make a
Chair.
new one, please.
All right, so I'm going to move once again to adopt House, let's see. Yep, House Article 2, sections 20 to 25 and section 80, paragraph B as amended.
Oh, hey, good catch on the amendment thing. Okay, all in favor of that, say aye.
Aye.
Opposed? That problem is rectified. Well, this is a good start. I'm really happy. Anything else anybody wants to say before I let us have a 4-hour break? Anyway, we're in recess. Thank you very much. See you at 6 thereabouts.
Thank you.
Well, yeah, where's the Hoffman bumper music?